Hi, this is Phyllis from SouthernFrugal.com. This morning it is bright and early and we're getting ready to go to the farmer's market. But we're also going to get Wheeler's teeth cleaned. And there he is, all sitting nice in the seat, ready to go. Wheeler, you going to get your teeth cleaned? Uh-oh. See, I'm thinking I might be afraid a little bit, but not much. Alright, so we're going to the farmer's market to get some apples. Hopefully the apples are in. It's September, so they ought to be, and I'm hoping I'm going to be able to get some Golden Delicious apples from North Carolina. I'm also going to try to get some oranges, and hopefully they'll have bananas this time, and sweet potatoes, also sweet potatoes from North Carolina. Alright, so I'll be filming once we get to the farmer's market. Alright, so see you in a few minutes. Okay, this is Dr. Harris. He's our vet, and we've just had Wheeler in to get his teeth cleaned, and he did have some problems. But of course, he's 11 years old now, so what kind of problems did you find, Dr. Harris?
Well, he has a lot of tartar that had built up on his teeth, and some of that tartar had actually gone up underneath the gum line. And consequently, because the tartar is produced by bacteria, all that bacteria was starting to eat away on the edges and the inside of his gum line where it touches the teeth. So we had a lot of infection in there. Now, you've been using antibiotics before we did the surgery, and that in itself helped us a lot with the infection, but because the tartar was still there was still infection there. So what I did today is, while he was asleep, I went ahead and took all of that tartar off, and I took my little scaling device and I went up, got it off of the teeth itself, and then went up under the gum line and took it off as far as I could. Now, that removal of all that tartar and the source of the bacteria will end the source of that bacteria going through his system, and it will allow us to use the antibiotics now and get rid of it.
So we're going to take the antibiotics, continue that for a while?
Correct. You've got a few left at home, so I'm going to have you finish those, and then you'll start with these. You're going to be given one of these capsules twice a day.
Okay.
You need to give it with some food. You can either wrap it up in a little bit of something that he likes to eat. You can even pull the capsules apart and pour the powder in something that he would like to eat.
Well, now, I'll have to tell you, he eats them right out of my hand. It's the only dog I ever had that would do that, but he does that.
You're especially blessed.
Yeah.
He's good at medicine. But it says that you're going to be given one capsule twice a day with some food, and I want you to give them until they're gone. Okay. So finish the ones you have, and then you'll start on these and just give them until they're gone. And that should take care of all the infection that's there. The anesthesia, let's talk about that for a second. Okay. I did reverse the drug that we used. And so he's wide awake. You can probably hear him back there. He knows you're here, so he wants to go home. But even though acts like he's not been under anesthesia today, you know he has, and so he's going to tend to be a little sick at his tummy. Okay. So what I want you to do is to not give him very much to eat or drink tonight. If he's really begging you for something, just give him a bite or two of some food or a lap or two of some water, and let that be it. If you give him much more than that, he's going to be sick at his stomach, and you're going to wind up cleaning it up again. Okay, all right. So just wait till in the morning to give him full food and water, and at that point, you can feed him what he normally would eat and drink. Okay,
so his mouth, you think, will be a little sore too?
Yes, it's going to be a little bit sore. Of course, it's probably better than it was, simply because we got all the tartar and the source of all the junk off. And I did mention to you out there that he had a piece of a broken tooth. I think it was on the lower right-hand side of his lower jaw. It was a little, where he'd broken a tooth off, there was a peg of the top of the root sticking up that was kind of sharp, so I went ahead and just removed that. That should heal up on its own. I also gave him an injection of some long-acting antibiotic that's going to last for the next 48 hours. So let's say in the morning that he's just really not interested in eating that much. That's fine. Just wait on starting the antibiotic until he is back eating for you again. Okay. Because he's covered with my shot for the next 2 days. Okay, great. So once he's back, got his appetite back, and he's eating for you, then you can go ahead and start these. Okay. And we're also going to send you home some of the Denahex. This stuff is really good. It's a chlorhexidine mouthwash, and it has an antiseptic material in it that's going to kill bacteria really well, but it's safe if he swallows it. Okay. And there's a couple of ways you can use it. You can just either twist the cap open like that and it's ready to go, and then once you've got it open, you can lift his lip up and just start squeezing. You squeeze across and come back, and then just let him decide what he wants to do with it. If he swallows it, it's fine. If he spits it out, it's fine. Just getting it in there is what needs to happen in order to kill the bacteria that forms the tartar. If he will let you brush, which I believe you told me that he will, then you can either squirt it on your finger cot or on the brush, or squirt it in his mouth and then use your finger cot to sit there and brush.
So now, am I going to be able to do this like long term with that type rinse there, or?
Yes,
I can just continue that like the rest of his life.
You will dramatically cut down the amount of tartar that builds up on his teeth by using this product at least a couple of times a week.
Okay, 2 times you think?
I think that'll be enough.
Okay, great. All right.
Now, if you want to, since he already has some gum disease, I would suggest using this every day for about 5 days in a row, just to get those gums to heal up for you. And then after that, just go to twice a week. Okay. And you don't have to brush each time you do it for these next 5 days. Just squirt it in his mouth. That's good enough.
Okay. All right. Sounds good. Now, of course, we've only had. Let me just get a close up of that. We have only had Wheeler for a year. You know, he was a rescue dog. Is this sort of a problem he's had along, or? Because, I mean, when I first got him, you know, we brought him here and had his teeth cleaned then, a year ago, and I wasn't very good at brushing them, maybe once a week, if that. So is some dogs just more prone to this than others are?
They are, and unfortunately, Wheeler has a lot of bacteria naturally in his mouth. Yeah. He went from having perfectly clean teeth to having really bad teeth in a year's time. Yeah. So you're going to have to watch closely. But if you are brushing his teeth, or at least squirting that stuff in his mouth a couple of times a week, you're going to be able to see as the tartar starts coming back on again. Yeah. As long as the tartar is down low on the teeth, the only significance to that is a bad breath.
Yeah, well, he has bad breath. Oh, really bad.
He doesn't anymore.
Okay, great.
He's got nice, fresh, clean teeth and good breath with a hint of minty freshness.
Oh, great, great. All right, I can't wait.
But once the tartar gets to the place that it's forming up on the sides of the teeth and starts to touch the gum line, at that point it's time to do something, because that's when the bacteria can get in the gums and start creating problems. Yeah. And there's a lot of blood vessels in those gums, and so when the tartar gets in there, the bacteria gets in there, it's going to start getting wicked into the bloodstream and go through the rest of the system. And his kidneys, his liver, and his lymph node has to filter all that stuff. And it's like a 24-hour IV of bacteria. And so that's when we wind up getting kidney problems, liver problems, abscesses.
So good thing I brought him when I did.
He desperately needed it this time.
Yeah.
But you're going to keep a good eye on it. So
yes, absolutely. Back. Now, the other 2 dogs are doing fine. They don't have that buildup like he does. So, you know, of course, I know they'll have to have theirs cleaned too, probably for too much longer.
Yeah, just keep an eye on it. Once the tartar gets up close to the gum line, it's time to do something.
Okay.
And there's some dogs that are that way. I mean, I had a dog that I wound up having to clean her teeth twice a year. And at one point, I smelled the smell coming from her breath, and I lifted her lip up. There was no tartar on her teeth, but her gums were just beet red from all the infection, from just having so much bacteria. Yeah,
okay. Well, this is great, Dr. Harris. Thank you so much. I'm going to post this on YouTube so other people can see it and maybe prevent their dog from having a problem as big as what Wheeler's got.
Well, it's important to do and consider, and people can check themselves. They just lift the lips, look at the gums and the teeth. Normally the teeth are going to look nice and white. The tartar has kind of a brown, yellowish brown appearance to it, sometimes a blackish brown.
Yeah, well, Wheeler's was black on that.
It was. And it just depends on the type of bacteria that's in there. But if they start seeing that brown tartar, and most dogs will have a little bit, as long as it's down low, close on the chewing surface of the tooth, that just tells you it's there and they need to keep an eye on it. But when it gets up to where it's actually touching the gums, they need to talk to their veterinarian about getting something done.
All right. All right, now tell me this. Is this a prescription, the Denahex? Is that a prescription, or can people get that?
People can just come in and get it. It's an over-the-counter product.
So most veterinarians would carry that, right?
Or something like it. That's correct.
Okay, great. All right, I'm ready for my dog now.
Well, let's go get him.
All right. Let me cut this off. We'll be right back when Wheeler Dealer comes out. There he is. There's a Wheeler dog.
Hey, buddy.
Say, I don't even know who my mama is right now. There you are. All right, we're going to go home. We'll see y'all in a minute. Okay, we are in the car now, ready to go home, and Wheeler is ready to go see his brothers. Of course, he's very interested in that other dog getting out. What you think? That's a big dog. All right. As y'all can see, I've got one great vet. He always explains everything, and anyway, I hope you got something out of this video about getting your dog's teeth cleaned and keeping them clean. All right, we will see you next time. And Wheeler says, Wheeler, do you say bye-bye? Say bye-bye. I got all clean teeth now. All right, see you next time. All right, we are home, and Wheeler's ready to see his other pack members, right? He's feeling good now, got his teeth all clean. All right, where are them other dogs? I think I hear them. There they are. Let's see. Open the door. Nobody hears me. All right, here we go. Here we go. Look at them. They're gonna greet me. Yeah. Yeah. Well, who is that? Is that your buddy, Pippi? Is that your buddy? There they are. Of course, they're greeting me too. Yeah. That's your buddy home, huh? There's Wheeler. Wheeler's greeting me too. Huh? All right, look at him. They got a smell of him. See what he smells like and smell of me and try to figure out where we've been. All right, that's enough. Everybody settle down. All right, we'll see you next time. I hope you got something out of this video with getting the dog's teeth clean, and especially that stuff that you can use to help keep the tartar off. All right, there you are. Wheeler act like he's feeling pretty good. Look at him. They're going to greet him and smell of him. See if they can figure out where he's been. All right, see y'all next time.